Hi, I'm Meena Ganesh. I'm the co-founder and CEO of Porte Medical. We are a home healthcare company which is based across 16 cities in India, headquartered from Bangalore. The reason why home healthcare is important in this country is because there is a fairly large population of people who are elderly, people who are suffering from chronic diseases, as well as hospital beds are always at a premium, and it's better for recovery to happen at home rather than in a hospital. Given all these macro factors, it was a very important part of the industry which was missing, or it was being delivered in a disorganized fashion. So local mom and shop players who there is no control over their quality, or we have no clue about their actual registrations or qualifications of people. Those were the people that were available to deliver a service of this nature. Now in the last about 4 years, this has come out as a more organized sector. We at Portia were the leaders. We started in 2013, and thereafter a few other players have also joined in. This is now a sort of inevitable or a mandatory part of the overall care delivery that other countries have always had, and now this has become part of this country's healthcare infrastructure also. What this does is it ensures that the predominant part of the healthcare spend, about 50% of the healthcare spend, actually happens outside of a hospital, and that is the piece that a home healthcare company or a consumer healthcare services company like us is attending to. What we are trying to do is to ensure that senior citizens, people with chronic diseases who have to manage their disease over long periods of time, have a very strong and good supportive network through which this can get delivered. The impact of this is that the chronic diseases can be managed better. Incidence of criticality, incidence of acuteness can be reduced and can be managed. Over the long term, the impact of this will be that the overall healthcare industry or healthcare spends per individual will get impacted, it will get better. Likewise, for people who are going for hospitalization, if they are able to get home 1 day, 2 days earlier than what they have been having to do in the past, there is actually a reduction in the overall cost. So economically it helps, socially it benefits, because it's always better to heal at home rather than in a hospital. So those are some of the impacts that we are seeing happening in this industry. See, the people like us, Portia, what we have done is from day one, we made sure that technology was a part of how this business was built. Whether how the customers get to know about our business, how they access the services, and how the medical management of these patients is happening. So technology is sort of embedded in the entire customer journey. What this does is that because outside of hospital care is not episodic in nature, but it's over a lifetime or over a long period of time, using technology to manage this whole journey really helps in tracking how the patient outcome is moving. Knowing the data, knowing the health situation of a patient over long periods of time, seeing how things are progressing, what other interventions need to be done. Can you use remote diagnostic tools which are left behind in patients' homes which can transmit data? All of that becomes a very key part of the overall care continuum. It's a very good question, because as I was mentioning earlier, one of the key areas that all of us focus on, this industry focuses on, are patients who are operational. So they have gone to a hospital, they have had a surgery. So post surgery patient management is a significant part of this whole industry. Now that is something which works in relationship or in collaboration with hospitals. So hospitals find that having this kind of infrastructure is very, very important. It ensures that the patients can go home earlier, so that releases their beds earlier for actual interventions to be done rather than for patients to just recover. What it also does is that it helps in tracking the patient's care over a long period of time, because the recovery may take months. In the meantime, the hospital and the treating doctor have lost track of the patient. They don't know if the patient got better, got worse, did they really follow the prescription that was given. So we become the glue between an intervention that happened and the actual outcome of the patient. So that is something which is very beneficial to the hospitals also. Yeah. So when we started Portia about 4 years back, Um, what we had earlier thought were some of the services that we had said we would start with, but as we started to work with patients, we realized what they're really looking at us for is to be the one-stop shop. They want to come to us and then say, just take care of all my needs. I mean, I don't want to go pillar to post. Somebody is coming out after a surgery, they've had a knee replacement. They don't need just a physiotherapist, they need a physiotherapist, they need some equipment, they may need some nursing to come and look at whether their sutures are healing, they'll need a nursing attendant to help them mobilize. There are so many needs and they don't want to run pillar to post. So from being service provider for a few services, we become a comprehensive solution provider to patients. So based on the needs of the patients, based on their disease condition, we come up with a full solution, and that's a big change that has happened in how we work with patients. So this is an industry which requires that you go into a patient's home on a day-on-day basis, provide services. So it's a high service intensity and high touch kind of a service. So you need really good quality manpower. So ensuring that there is adequate supply of manpower of the kind that you need, and they are trained and they are able to provide the service on a consistent basis across a large population of patients, that is something which is a high, it's a big challenge for the industry. So we have spent a lot of time and effort in determining where we can get these people, what kind of training would be ideal, what are the protocols they should be using, what kind of monitoring we should do, how do we use technology to ensure that there is consistent delivery. So it's a lot of work we've done to ensure that the customer experience and the patient management is of the utmost quality. Now in doing that also, as we started to become more specialized around specific areas, so like you rightly said, we've not just grown in size, meaning we are in 16 cities, we have 4,500 people, but also we have become experts in specific diseases, like whether it's managing cancer patients or managing patients with neurological disorders or dementia, elderly patients with dementia. We've now created very detailed solutions, and that really helps the patient to get the care end to end from one partner. Absolutely, you're absolutely right that we not only are helping patients, but we are also creating longitudinal data for the industry for certain kinds of diseases by geography, and I think that is also extremely valuable. India as a country does not have very good medical data, on the ground data that is available. So we'll become one of the key repositories of longitudinal data.